I want to talk to you today about something that disturbs the sleep of a fair number of older adults and that they rarely connect to anything serious, yet that occasionally deserves attention, including, in certain contexts, regarding the heart. Waking at night drenched in sweat, night sweats, and how to think about them sensibly, including the rare situations where sweating relates to the heart. Because waking sweating is uncomfortable and usually put down to a warm room or the bedding, yet persistent. Drenching night sweats can sometimes be a sign of an underlying condition worth checking, and sudden sweating can, in specific contexts, relate to the heart. So understanding when night sweats deserve attention is genuinely worthwhile, held in proportion. So today I want to explain the common causes of night sweats, when they warrant checking, the relationship to the heart, the important distinction from the cold sweat of a heart event, and what to do, in partnership with your doctor. And I'll keep this calm and balanced, because while most night sweats are benign, persistent drenching ones warrant checking, and sweating relates to the heart mainly in the acute context of a heart event. So understanding the difference lets you respond wisely, in partnership with your doctor. This is about reading night sweats sensibly, including their relationship to the heart. Let me start by being clear that most night sweats are benign, because that's true. Most night sweats are benign and have common, often simple causes. The commonest is simply a too warm sleep environment, too many blankets, a hot room, or heavy bedding, which makes you sweat, easily remedied. Other common causes include hormonal changes, like the hot flushes and night sweats around menopause, though less relevant in later life. Certain medications, which can cause sweating. Alcohol, especially in the evening. Spicy food, anxiety and stress. And minor illnesses with fever. So most night sweats are benign, from a warm sleep environment, medications, alcohol, or minor causes, and are easily addressed. So please don't take occasional night sweats, especially from a warm room or bedding, as a serious concern. The majority are benign. The nuance I'll discuss is about persistent, drenching, or unexplained night sweats warranting checking, and the specific heart context, not ordinary night sweats being a worry. So most night sweats are benign, from a warm environment, medications, alcohol, or minor causes, while the nuance is persistent or unexplained sweats and the heart context. So most night sweats are benign, so ordinary night sweats are usually harmless. Let me explain when night sweats warrant checking, because some genuinely do. While most night sweats are benign, certain night sweats warrant seeing your doctor, because they can occasionally signal an underlying condition. See your doctor for night sweats that are persistent and recurrent, happening regularly over weeks, rather than the odd warm night. Are drenching, soaking your bedclothes or sheets, not explained by a warm room. Are accompanied by other symptoms, like unexplained weight loss, fevers, fatigue, or feeling unwell, which together are more concerning. Or are new and unexplained. Persistent, drenching, unexplained night sweats, especially with these other symptoms, can occasionally signal underlying conditions, including infections, hormonal or thyroid problems, certain medications, and, sometimes, more serious conditions worth catching, so they warrant assessment. So see your doctor for persistent, recurrent, drenching, or unexplained night sweats, especially with weight loss, fevers, fatigue, or feeling unwell, since these can occasionally signal an underlying condition worth checking. So persistent or drenching night sweats with other symptoms warrant checking, so heed persistent, drenching, or unexplained night sweats. So some night sweats genuinely warrant a look. Let me explain the relationship to the heart, because it's mainly in a specific context, while being accurate. Let me be accurate about the heart relationship. Ordinary chronic night sweats are not typically a heart symptom, and the conditions they more often relate to are the infections, hormonal, and other causes I've mentioned. So I won't overstate a heart link for chronic night sweats. However, there are two heart-related contexts worth knowing. First, and most important, the acute context. As I've discussed, a sudden cold sweat, breaking out in a sweat, especially with other heart attack symptoms, can be part of a heart attack. But this is an acute sudden sweating with other symptoms, quite different from the chronic night sweats I've mainly discussed. Second, rarely, certain heart-related infections, like an infection of the heart valves, can cause night sweats along with fevers and feeling unwell, which is part of why persistent night sweats with such symptoms warrant checking. So chronic night sweats aren't typically a heart symptom, but a sudden cold sweat with heart attack symptoms is an acute heart context, and rarely a heart infection can cause night sweats with fevers. So chronic night sweats aren't typically cardiac, but the acute cold sweat of a heart attack and rarely a heart valve infection are heart-related contexts. So the heart relationship is mainly the acute cold sweat, plus rarely a heart infection. So sweating relates to the heart mainly acutely. Let me stress the crucial distinction from the cold sweat of a heart event, because it matters. Let me stress this crucial distinction. The chronic night sweats I've mainly discussed, recurrent sweating at night over weeks, are quite different from the acute cold sweat of a heart attack, which is a sudden onset of sweating, often cold and clammy, accompanied by other heart attack symptoms like chest discomfort, breathlessness, nausea, or pain in the arm or jaw at any time, not specifically a recurrent nighttime pattern. So please distinguish. A sudden cold sweat with heart attack symptoms is a possible heart attack and an emergency, as I've discussed, while recurrent night sweats over weeks are a different matter warranting non-urgent checking. Don't confuse the two. The acute cold sweat with chest symptoms is the heart emergency, while chronic night sweats warrant seeing your doctor. So distinguish the acute cold sweat with heart attack symptoms, an emergency, from chronic recurrent night sweats, which warrant non-urgent checking. So the acute cold sweat is the emergency, chronic night sweats are not. So don't confuse acute cold sweats with chronic night sweats. Let me reinforce the heart attack emergency because it's crucial. Crucially, treat as a possible heart attack and call emergency services immediately if you suddenly break out in a sweat, especially a cold, clammy one, accompanied by chest discomfort or pressure, breathlessness, nausea, lightheadedness, or pain in the arm, jaw, shoulder, or back, or feeling very unwell, as I've discussed about the cold sweat of a heart attack. This is regardless of time of day and is different from your recurrent night sweats. So while chronic night sweats warrant seeing your doctor non-urgently, a sudden cold sweat with heart attack symptoms is an emergency. So treat a sudden cold sweat with heart attack symptoms as a possible heart attack and call emergency services immediately, distinct from chronic night sweats. So the sudden cold sweat with heart symptoms is the emergency. So act urgently on a sudden cold sweat with heart symptoms. Let me be clear about what to do, because the response should match the sweating. So here's what to do. For a sudden cold sweat with heart attack symptoms, chest discomfort, breathlessness, nausea, or pain in the arm or jaw, call emergency services immediately as a possible heart attack. For persistent, recurrent, drenching, or unexplained night sweats, especially with unexplained weight loss, fevers, fatigue, or feeling unwell, see your doctor to check for underlying causes, which can include infections, hormonal or thyroid problems, medications, and, occasionally, more serious conditions. For occasional night sweats clearly from a warm room, heavy bedding, alcohol, or a minor illness, simple measures, cooling the room, lighter bedding, and addressing the cause, usually suffice, and mention any troubling or persistent night sweats to your doctor. So call emergency services for a sudden cold sweat with heart symptoms. See your doctor for persistent or drenching night sweats, especially with other symptoms, and address benign environmental night sweats simply. So match your response to the sweating. So respond per the sweating, urgently when acute. Let me paint you a quick picture of how this helps. Picture a man in his 70s who's been waking several nights a week drenched in sweat, soaking his bedclothes, along with some unexplained weight loss and feeling generally unwell, which he's dismissed as just a warm room. Understanding that persistent drenching night sweats with weight loss and feeling unwell warrant checking, he sees his doctor, who assesses him and investigates, finding and addressing an underlying condition the night sweats were signaling. Separately, the same man knows that, quite differently, If he ever suddenly broke out in a cold sweat with chest discomfort and breathlessness, that would be a possible heart attack needing emergency services immediately. So he heeds his chronic night sweats appropriately and knows the acute cold sweat is a different, urgent matter. The same man, but reading his night sweats sensibly and distinguishing the acute cold sweat, got an underlying condition checked and knows the emergency sign. That contrast is exactly why reading night sweats sensibly, including their heart relationship, matters. Let me speak briefly to those of you caring for an older parent or partner. Understand that most night sweats are benign, from a warm environment or minor causes, but that persistent, recurrent, drenching, or unexplained night sweats, especially with weight loss, fevers, fatigue, or feeling unwell, warrant checking for underlying conditions, and that the heart relationship is mainly the acute cold sweat of a heart attack, plus rarely a heart infection. You can help by addressing benign causes, a cooler room and lighter bedding, but encouraging seeing the doctor for persistent, drenching, or unexplained night sweats with other symptoms. Crucially, distinguish and treat a sudden cold sweat with heart attack symptoms as a possible heart attack, calling emergency services immediately. Helping a loved one read night sweat sensibly can catch underlying conditions and ensure the acute cold sweat is recognized as an emergency. So let me draw this all together. Waking at night drenched in sweat, night sweats, is most often benign, from a warm sleep environment, heavy bedding, medications, alcohol, or minor causes. But persistent, recurrent, drenching, or unexplained night sweats, especially with unexplained weight loss, fevers, fatigue, or feeling unwell, warrant seeing your doctor, since they can occasionally signal underlying conditions including infections, hormonal or thyroid problems, and sometimes more serious ones. Regarding the heart, chronic night sweats aren't typically a heart symptom, but two heart contexts matter. The acute cold sweat of a heart attack, which is sudden and with other heart attack symptoms and an emergency, quite distinct from chronic night sweats, and rarely, a heart valve infection causing night sweats with fevers. So call emergency services for a sudden cold sweat with heart attack symptoms. See your doctor for persistent or drenching night sweats, especially with other symptoms. And address benign environmental night sweats simply, distinguishing the acute cold sweat from chronic night sweats. So here's what I'll leave you with, straight and clear. First, understand that most night sweats are benign, from a warm sleep environment, heavy bedding, medications, alcohol, or minor causes. So occasional night sweats from a warm room are usually nothing to worry about. Second, know that persistent, recurrent, drenching, or unexplained night sweats, especially with unexplained weight loss, fevers, fatigue, or feeling unwell, warrant seeing your doctor, since they can occasionally signal underlying conditions worth checking. Third, understand the heart relationship. Chronic night sweats aren't typically a heart symptom, but the acute cold sweat of a heart attack, sudden and with other heart attack symptoms, is a heart-related emergency quite distinct from chronic night sweats. And, rarely, a heart valve infection can cause night sweats with fevers. Fourth, and crucially, distinguish and treat a sudden cold sweat, especially cold and clammy, accompanied by chest discomfort or pressure, breathlessness, nausea, lightheadedness, or pain in the arm, jaw, shoulder, or back, as a possible heart attack, and call emergency services immediately, regardless of time of day. And fifth, see your doctor for persistent, drenching, or unexplained night sweats, especially with other symptoms. Address benign night sweats with a cooler room, lighter bedding, and addressing the cause, and mention any troubling night sweats to your doctor. Most night sweats are benign, but persistent drenching ones warrant checking, and the acute cold sweat of a heart attack is a distinct emergency. So, reading night sweats sensibly lets you respond wisely, catching underlying conditions and recognizing the heart emergency, which is well worth doing. So take care of yourself, address benign night sweats, get persistent or drenching ones checked, and act urgently on a sudden cold sweat with heart symptoms. And because persistent night sweats can occasionally reflect an underlying condition needing diagnosis, and a sudden cold sweat with heart symptoms can signal a heart attack, Please treat persistent drenching or unexplained night sweats, especially with weight loss, fevers, or feeling unwell, as your reason to see your own physician, and a sudden cold sweat with heart attack symptoms as your reason to call emergency services immediately. This touches on sleep and on symptoms that can occasionally signal serious conditions. So if persistent night sweats or other worrying symptoms are troubling you, please know they warrant seeing your doctor, who can find the cause and help.